the urinary system? Okay, just checking. Because the urinary system, we've got a kidney. While we're talking about the kidney, there's the adrenal gland. It's this top part stuck on top of the kidney. But we have a kidney. Well, I got this kidney out. Nope. A renal artery, renal vein. So that's our kidney. We're going to use this big diagram for the kidney because it works just as well as anything else. And note the outer area, that's the cortex. These are the renal pyramids. They're also the medulla. And each one of these, you notice that the nephron, there's a little ball where the arteries come in, arterioles come in. That is the renal corpuscle. We have a huge model of a renal corpuscle here. We see the afferent arteriole coming in, going into the little capillary bed, coming out as an efferent arteriole. This capillary bed is called the Bowman's capsule or the glomerulus. It's where all these little capillaries are. The blood flows in, gets filtered out, fluid goes down into the nephron, blood cells and excess fluid continues on through the afferent arteriole. Now, as it goes down, we'll just follow this part here. First, this big squiggly line is the convoluted tubule, the proximal convoluted tubule. Then it goes down here to the loop of Henle. There's a descending part, ascending part. It comes up here, and this is a distal convoluted tubule. This one shows a better convolution. That's the distal convoluted tubule. It goes into a collecting duct, collecting tubule, and onto a calyx. And we will continue on. I'll point out the calyxes right here. All the calyxes come together to the renal pelvis, and they dump into the ureter. This is where the kidney stones will form, pass on down the ureter. And we will move on to pointing out the ureters here. We have ureters. They come on down. They dump into the bladder. There's the male bladder. We'll show you the female bladder while I'm standing here, if I can find my female. There's a female. You can see the female bladder. It's underneath the uterus. There's a female bladder, urethra. Male urethra is the same, well, it's through the male genitalia. And that is the urinary system, which allows us now to go on to the reproductive system. We will first take care of the female reproductive system, of which I just dropped it. We'll look at this one. First part of the female reproductive system, ovary. Fimbria. Notice the little fibers and stuff. Uterine tube. That's where the ovum passes on to get to the uterus. Uterus. Notice the myometrium of the uterus, the muscular wall of the uterus. Then we have the cervix and the vagina. And that is the female reproductive system. We'll pull out the male reproductive system while we're here. Male reproductive system. Testes, epididymis. We have, well, of course we see the bladder and the urethra, prostate. But we are going to use the diagram for most of this because the diagram is much clearer. See the purple structure? Vas deferens. Epididymis, vas deferens. And then, if we go up here, we'll see the seminal vesicles, the ejaculatory ducts. These are coming off the vas deferens. The prostate. And there's the urethra again. And, of course, we have the penis. Now, if we were to do a cross-section of the penis, we can see the interior structure of the penis, which we will use the penis that I just dropped off here. Do a cross-section. Corpus cavernosa. These are the ones that fill in with blood during the erection. And a corpus spongiosum. That surrounds the urethra. We can also see the spermatic spermatic cord. So that is the male reproductive system and everything on the test.